Hello everyone. In this video, we'll discuss about Rotor syndrome. So another inherited condition related to bilirubin metabolism. Rotor syndrome is mainly caused by impaired transport and reduced storage capacity of conjugated bilirubin. Mark this point: impaired transport and reduced storage capacity of conjugated bilirubin. This means that the liver has trouble efficiently handling bilirubin, leading to its buildup in the bloodstream. So, this condition involves both direct hyperbilirubinemia due to impaired transport and mild indirect hyperbilirubinemia. So, the syndrome follows an autosomal recessive inheritance pattern. Clinically, Rotor syndrome is usually asymptomatic, which means patients don't experience significant symptoms. However, some individuals may develop mild jaundice, particularly under stress or illness. So, the presentation is milder compared to Dubin-Johnson syndrome, and there are no specific triggers like contraceptives or pregnancy that worsen symptoms. And the diagnosis of the Rotor syndrome is mainly based upon the combination of laboratory tests and liver biopsy findings. So, the blood test reveals direct hyperbilirubinemia with a small increase in indirect bilirubin. Importantly, liver function test remains normal, which helps to differentiate Rotor syndrome from other liver diseases. And another hallmark is an increased urinary coproporphyrin 1 and 3, which is distinguishing feature of this particular condition. And on liver biopsy, the liver appears completely normal with no dark pigmentation, what we have seen in the Dubin-Johnson syndrome. So the treatment for Rotor syndrome is not required, mainly because it's a benign condition and patients usually lead normal lives without any complications. So there are no specific medications or lifestyle modifications needed, as the condition rarely causes symptoms and affects the overall health. So this is what we need to know, all the important points regarding Rotor syndrome.